The syndrome of inappropriate antidiuretic hormone secretion, known as SIADH, is when your body is producing too much of a hormone called vasopressin. Vasopressin, which is also known as the antidiuretic hormone, helps the kidneys and the body conserve the correct amount of water. Secretion occurs when excessive levels of antidiuretic hormones are produced, resulting in retained water and specific electrolytes to drop, especially sodium, resulting in hyponatremia. The list of causes for this disease is over a dozen of various disorders. It is also mainly a result of a vasopressin being produced outside of your pituitary gland. Some of the more common ways to cause this disease include meningitis, encephalitis, brain tumors, Guillain-Barré syndrome, lung disease, and certain medications. The most published medications that draw concern are vasopressin and its analogs, thiazide and thiazide-like diuretics, chloropropamide, carbamazepine, antipsychotics, antidepressants, and non-steroidal anti-inflammatory drugs. Risk factors for this disease include old age, following the use of many of the drugs listed. The use of those drugs in combination with excessive fluid intake and underlying conditions that will limit free water excretion will also increase the risk for this disease. The different clinical manifestations vary with each individual, but nausea, vomiting, cramps, tremors, irritability, personality, and mood changes are the more common. Complications of SIADH stem from the blood sodium levels. Potential complications are headaches, memory issues, depression, tumors. Severe complications that will affect other body systems include respiratory failure, neurological problems like coma, seizure, or hallucinations, but this disease can also be fatal. The first step in treating this disease is treating the cause, whether treating an infection or stopping a certain medication. If you have had an underlying condition that is not correctable, such as metastatic cancer, medications like demeclocycline are prescribed. IV conivaptan, a selective vasopressin receptor antagonist, causes an effective water diuresis without significant loss of electrolytes in the urine. It can also be used in hospitalized patients for treatments of resistance to hyponatremia, which is low sodium in your blood. Then, after managing the underlying condition, you will assess and treat the patient's fluid restriction. 250 to 500 milliliters every 24 hours is the most common intervention to control their intake. A loop diuretic combination with IV 0.9% would be administered as well for hypervolemic hyponatremia. Hypertonic saline infusion should be reserved with patients with severe symptomatic hyponatremia and be used cautiously. If you are administered this too rapidly, to correct your fluid intake, the risk of onset of osmotic demyelation syndrome can occur. You must follow strict fluid intake to prevent any other fluid buildup. Certain signs and symptoms that were reviewed for hypo and hypernatremia should be understood, so when you need to seek medical attention if they become present. Lastly, compliance with treating the underlying condition must be a priority.